Now we are moving on the other group of drugs. Like we are in this video, we are going to discuss regarding the what we have not discussed this type of drugs. So first, I am going to start with the barbiturates. In barbiturates, there is only one drugs. In barbiturates there is some drugs like which are used. First is the like phenobarbital, phenobarbital phenobarbital. And when you look regarding this, it is like first efficacious anti-epileptic, which is like used in the like or introduced in the 1912. It is introduced. So it is like first anti-epileptic, first efficacious anti-epileptic. Epileptics. And regarding this is like a wide spectrum of anticonvulsant. It has wide spectrum of anticonvulsant property. When you look like it is a GABA mimetic as well as GABA facilitative property. It is GABA mimetic as well as GABA facilitatory property. It's, and when you look at it increase the duration of the opening of the chloride channel. Like when you look at the MI, it increases the duration of opening of chloride channel, which we have already discussed in the like MOA of the some drugs initially in the first video. And there is like it is a slow oral absorption. When you look at the pharmacokinetics, it is slow oral absorption, and half-life is 80 to 120 hours. And it's metabolized in liver. And when you look at the excretion, it's excreted through the kidney. Now it is useful in the like general. It is used in generalized tonic-clonic seizures, and also using the simple and partial and complex partial seizures. Regarding ADR of this drug or side effect, when you look at the side effect, so regarding side effect, it is there is a behavioral abnormality, behavioral abnormalities. There is a hyperactivity in children. There is mental confusion in the older person and mental confusion in older people. This is all regarding the like phenobarbital. Now we are moving on to another drug. Another drug is deoxybarbital. So in the deoxybarbital, barbiturates, or the group deoxybarbiturates, and the drug is primidone. Regarding primidone, it's converted into liver. It's converted by liver into phenobarbital, phenobarbitons and phenyl ethyl malonamide, known as PEMA. So it's converted into in the liver, primidone to the phenobarbital and the phenylethyl malonamide. And when you look the efficacy of this drug, so it is efficacy just similar to the phenobarbital. So efficacy similar to phenobarbital, and regarding the side effect, it has anemia and the leukopenia as a side effect. Anemia and leukopenia is a major side effect. And regarding contraindication, it is contraindicated in patient with either porphyria or hypersensitivity with the sensitivity to the phenobarbital. Contained in the patient with either porphyria or hypersensitivity to phenobarbital. And this is regarding the deoxybarbital of the drug primidone. Now we are moving on the another class of the drug known as hydantoin. Regarding hydantoin, in the hydantoin there is a phenytoin or group of phenytoin drugs. Drug name is phenytoin. And regarding this, phenytoin exert anti-seizure activity. So it exerts anti-seizure activity, and it's without causing general depression, generalized or general depression of the CNS. And when we look regarding the sedation effect or anti-epileptic effect, so here is no sedation or sedating, oral anti-epileptic drug. It is a non-sedating anti-epileptic drug which is used orally drug. Regarding MOA, its prolongation. It helps in the prolongation of sodium channel. And regarding sodium channel inactivation. And when we discuss regarding the other mechanism of action, it inhibits inhibition of It's inhibition of excitatory glutamatergic synapse and facilitator, like it facilitates also it has an action on the GABA, so it facilitates GABA, also inhibitory transmitter release. And like when you look this drug, where it is actually a standard drug for generalized tonic-clonic seizure, and also for the partial seizures. And regarding flow of, like it's follow a kinetic first, follow the saturation kinetics, so it follows the saturation, so the kinetic change from the first order to the zero order within the therapeutic concentration. Like first it's act by the first order kinetics, then in fall in the zero order kinetics, and this is within therapeutic concentration. This fall on the therapeutic concentration. So moving on the like ADR of this drug, and when there is a ADR, some ADR or side effect of this drug, at the therapeutic plasma concentration there is some ADR, and there is some higher concentration, so it is a normal or at therapeutic concentration of 80 concentration plasma concentration, and there is higher dose. So at the therapeutic concentration plasma concentration there is gum hypertrophy, then there is hirsutism, then there is hypersensitivity reaction, then there is megaloblastic anemia, then there is osteomalacia, then there is coital hydantoin syndrome, fetal hydantoin syndrome. At the higher concentration there is some ADR, like there is a cerebellar vestibular manifestation, like ataxia, then vertigo, drowsiness, then there is mental confusion. After there is epigastric pain, then there is fall in BP, and cardiac arrhythmia. There is cardiac arrhythmias as a side effect of the high dose. So when we look at the interaction of the phentoins, so in the when you look at the interaction of the other drugs, so there is like some interaction, like it is phenytoin is a potent inducer of the CYP2, C8, C9 and CYP3, A4 and A5. So some it's also induced some other enzyme. So phenobarbital completely inhibit the phenytoin metabolism, and while the enzyme induce the both enhance the each other degradation, carbamazepine and the phenytoin induce the each other metabolism. So there is a more metabolism occur. Valproate depress the protein bound of phenytoin and decrease its metabolism. And also we look the other drugs like carbamazepine, isoniazid, cemetidine, and warfarin inhibit the phenytoin metabolism. So due to this enzyme inducer, and phenytoin induce the microsomal enzyme and the increase the degradation of the steroid and failure of the oral contraceptives. So there is a doxycycline and theophylline and failure of the contraceptive failure on other drugs. And there is sucralfate bind to the phenytoin in the GI tract and decrease the absorption. Sucralfate binds with the this drug bind with the phenytoin and decrease the absorption of the phenytoin. These are the some interaction of the drugs. So now other drugs of this group hydatoins are the phosphenitoin. Regarding phosphenitoin, this is the water soluble drug. It is water soluble prodrug. So prodrug of it is a prodrug of the phenytoin. So it has been induced for the overcome the difficulty of the IV administration. It is developed for the decrease the difficulty. What are the difficulties seen in the phenytoin? So it is used as the decrease the difficulties when phenytoin is used IV. So there is on the IV injection, it is less damaging to the intima. Only the it's decrease the damage of intima layer of the blood vessel, intima, and also it only the minor vascular complications are produced. So here is a rare or minor vascular complication, seen with IV, and seen or produce. So when you look this, while phenytoin cannot be injected in a drip of the glucose solution because it gets precipitated, so the phosphenitoin can be injected with both the saline and glucose. In the case of the phenytoin, it is binded with the glucose when it injected it through the IV, and it's go in the blood vessel or circulation. It bind with the glucose and precipitate. So this precipitation decreases by this phosphenitoin. There is no precipitation occur. So it is given as injected with the both. It is injected with both saline and glucose. Now we are moving on the another group of drugs like immunostilben, immunostilben. So in this group there is one drug known as carbamazepine. So it is a first line anti-epileptics drug, and which are used where it is the first line of period. So it is first initially used carbamazepine. Regarding the action of this drug, so its action on sodium channel similar to phenytoin. What the action of the phenytoin is like prolongation of the like sodium channel inactivation, so that way it's also work. And when you look at the antidiuretic action, it has an antidiuretic action by enhancing the ADH secretion on the renal tube. So increase ADH, so lead to the like increased absorption of water from the kidney. So it is preferred in the like diabetic insipidus case. And also it is a drug of choice for the trigeminal neuralgia. Trigeminal neuralgia. And when we look, it is not useful in a diabetic, traumatic and the other form of neuropathic pain. Not useful in a diabetic and other traumatic and the other form of the neuropathic pains. So it has some ADRs or side effects of this drug. So when we look at the side effect, it is a dose related toxicity. When we look at doses, there is sedation, dizziness, vertigo, diplopia, and then there is ataxia. And when we look at the other symptoms like GI tract, there is a vomiting, diarrhea, and there is like hypersensitivity reaction like cyber reaction, rashes, potassium, cystine, hypersensitivity reactions like rashes, photosensitivity. And when you look at that, there is a water retention, hyponatremia, more common in elderly. So water retention due to the increase of secretion of ADH, water retention, and hyponatremia, more common. Like it's in hyponatremia, in the case of like there is a more water in the plasma, and as compared to the water, there is a sodium is less, so there is a hyponatremia. So when we discuss regarding the interaction of this drug with the other, so it is an enzyme inducer interaction. So it is enzyme inducer, and like it can be reduce the efficacy of haloperidol. It's reduce efficacy of haloperidol. Oral contraceptives. There is also like lamotrigine and valproate topiramate is also decrease the efficacy of these drugs. Like it's also decrease the efficacy of lamotrigine. So this drug are not combined with this drug. Lamotrigine not combined with the like carbamazepine, and there is a valproate, and also it's decrease efficacy of topiramate. Now moving on to metabolism, it is it is metabolized in the metabolism is induced by the phenobarbital, so it's vice versa action. So, and when you look at the metabolism, it's inhibited by the erythromycin. Its metabolism inhibited by the erythromycin and fluoxetine and isoniazid. So when the given of this drug isoniazid, fluoxetine and also erythromycin. So this drug is inhibit the metabolism of this drug. So there is a increase the plasma concentration of the carbamazepine. Now moving on to the other drug in this class. So other drug is oxcarbazepine. Oxcarbazepine. So regarding oxcarbazepine, it's a newer congener of carbamazepine, and rapidly converted to an active metabolite that is like only gluconate conjugation but not oxidized. So metabolized by glucuronide conjugated and not oxidized. And when we look like it is a weak enzyme inducer, so the drug interaction and auto induction is less marked. So weak enzyme inducer, so less auto inductions. And when you look at the risk, there is a risk of or adverse, there is a risk of hypertoxicity lower than the carbamazepine. So that of the hyponatremia is more. There is a decreased risk there than the hepatotoxicity is compared to less than hepatotoxicity, less than carbamazepine. And the other drug of this class is carbazepine. I am going to briefly explain regarding this drug, and then there is another class of drug like succinimide. So regarding this carbamazepine is a primary agent for treatment of the generalized absence used for generalized absence seizures, and is also approved used for the myoclonic seizures, and its MOA, when you look at the MOA, it's inhibit T-type calcium channels. When you look at the primary action appear to the exerted on the thalamocortical system, so which is involved in the generation of the absence seizure, and its primary action appear in the thalamocortical action on thalamocortical system, and which is involved in the generation of absence seizure. So it is act as when there is there is an increase of the absence seizure. So when you look at the area of this drug, so this is not regarding the carbamazepine. This is the regarding of the succinimide class of drug. Succinimide class of drug. The drug is ethosuximide. So this is the regarding this ethosuximide. So here is the some ADR or side effect. In the side effect, there is a dose-related side effect like GI intolerance, tiredness, mood change, agitation, headache, hypersensitivity. And I sorry for that I have explained that this is easily carbamazepine. Regarding this carbazepine, this drug is like intamer of the product is the very rapidly converted to the liver, same active metabolites as oxcarbazepine, and it's approved on the add-on drug for the partial seizure. This much is given regarding this drug.